All right, welcome everybody. My name is Dave Ledoux. I'm the Media Relations Director for the Sheriff's Department. At the end of our presentation here, you guys are going to get a QR code that has videos and photos for download if you need them for your stories. We'll also provide all the information regarding the media jail tour that's going to be at the end of the event. All that information is going to come once we finish up here. If everybody's ready to go, is there anybody not ready? All right, I'm going to welcome to the podium Sheriff Kelly Martinez.
Yeah, good morning, everyone. Thank you so much for being here. I'm Sheriff Martinez. As David said, at the end of this presentation, you'll be given the opportunity to tour the Rock Mountain facility. And today we're holding this press conference to talk about the opening not only of the Rock Mountain facility, but also a lot of our jail improvements. We put out jail improvements in January, and I thought it was a good time to update you and also make available my staff to talk to you directly about the things that they're working on. We're going to share the challenges that we face as well as the timeline for all of our work. And the management staff that's with me today, I'd like to introduce now. To my right is Assistant Sheriff Teresa Adams-Hydar. Next to her are my three commanders who are in charge of operating and securing our 7 detention facilities across the county. We have Commander Chris Buchanan. He oversees reentry services, the Detentions Processing Division, food services, the Rock Mountain Transition, and detention support, among other things. Commander Christina Bavinkoff is responsible for supervising and managing all of our 7 county jails. Commander Ken Jones oversees medical services, transportation, training, and investigation in our jails. To my left is Support Services Manager Chris Thibodeau, Chief Medical Officer Dr. John Montgomery, followed by Melissa Quiros, our Mental Health Director, Reentry Services Manager Patricia Ceballos, and then Lieutenant David Blackwell, who oversees the technology projects in our detention facilities. This is some of the leadership team, but I want to make it clear that there's a lot of people who are making all the improvements to our jails possible. The day-to-day operations of our jails take thousands of individuals, from the initial intake to housing, feeding, healthcare, clothing, hygiene, court appearances, paperwork, tracking, communications, transportation, and so many other operations. We have a committed team of professionals who process, house, and keep thousands of individuals in our custody safe. Having said that, the team with me today will be available for one-on-ones for any of you that want to speak with them after the presentation. To outline today's format, I'm going to begin by going through some of our major initiatives, and then I will ask Assistant Sheriff Adams-Hydar to talk a little bit about the American with Disabilities Act, or the ADA compliance in our jails. She'll be followed by Support Services Manager Chris Thibodeau, who's going to talk about the infrastructure projects that we have going on. After that, I'll come back up to the podium to answer questions. We want to provide you time to interview and ask questions of the team, but then we also still have the tour of Rock Mountain, so we'll try to move this along for you so you can get down there. The importance of opening the Rock Mountain Detention Facility cannot be overstated. This jail is the linchpin to the much-needed and long overdue improvements to the George Bailey Detention Facility and all of the other jails in our system. The jails in San Diego County do operate as a system, and having space to move people to while we do the much-needed construction work at another one is key to our improvements. When you tour the Rock Mountain Detention Facility, you will note that it is not finished, that it will be used initially to house about 200 individuals. The Rock Mountain Jail is not complete, but it is supported by the George Bailey Detention Facility right next door, and everyone in our custody will receive the same level of services there that they get in our other jails. By partially opening the Rock Mountain facility, we will be able to clear housing areas in the George Bailey facility to start the much-needed renovations at that jail. You'll hear more about this from Chris Thibodeau and during the tour of the facility. Now I'd like to talk to you about medical services that we provide in our jails. Many of the individuals who come into our custody need a lot of health care services. As you can imagine, we must provide health care to people related to substance use disorder, mental health conditions, lack of ongoing medical care, poor diet, and a number of pre-existing conditions. In the last year, we have made a lot of progress in enhancing our healthcare services to ensure the safety of individuals in our custody. Everyone coming into our jail is medically screened at intake. One of the primary changes to our medical screening protocol includes a voluntary urine screening. This screening helps us identify what substances people have in their system when they come into the jail, and that guides what we provide them as far as treatment and withdrawal protocols. We also want to maintain treatment that many people have had prior to custody related to addiction, as well as providing them a path out of addiction while they're in our custody. We have expanded the Medicated Assistant Treatment, or MAT, program in our facilities, and we can treat people more robustly in our facilities through programs that work with medication and counseling to reduce addiction. When someone's released, they are then provided resources for continuity of care in the community to support long-term recovery. The goal is to reduce returns to custody and to improve outcomes. We continue to improve the electronic health record systems in our jails, and this makes medical information easier to access and available to providers who service people in custody. The Tech Care system streamlines administrative tasks associated with record keeping, giving medical staff more time to focus on patients. We all understand the need for increased mental health initiatives in our society, and it's even more important in the jails. We know that a large portion of our jail population need mental health services. We provide assessments at intake so we can provide mental health services appropriately. At any one time, we have about 400 people in our custody who are unable to take care of themselves. If left unassisted, they'll fail to eat, shower, or keep themselves clean. We instituted a program to make sure these individuals do not slip through the cracks. These wellness checks involve a multidisciplinary group of our staff that includes deputies, medical and mental health providers, and correctional counselors. This group visits these individuals weekly in their cells to assess if the person is eating, bathing, sleeping, and generally taking care of themselves. We can identify concerns and risks earlier and get people the help that they need. We have found that people respond well when they can count on these weekly check-ins. In addition, the wellness checks can be an indicator that someone needs medical or mental health decisions made on their behalf. This early warning system allows us to work with the court sooner to begin the conservatorship process in cases where decisions need to be made on behalf of patients. We have individuals in jail who are not competent to stand trial based on their mental health needs or ability to defend themselves. After a finding by the court, they can be entered into the jail-based competency treatment program. This program provides specialized mental health treatment so that individuals can be restored to a level of competency that enables them to participate in their own defense during court proceedings. Dr. Montgomery and Melissa Kuros will be available to provide more details and answer questions regarding our many initiatives in medical services. We're doing a lot to prevent drugs from getting into our jails. Most of the work centers around just good old-fashioned investigations. We know from evidence that most of the drugs enter our jail at intake, through the mail, and when people are transported to and from court. We focus on these areas but work on all possible access points to interdict drugs and other contraband from getting into our jails. One of the key measures we have taken is to train and deploy deputies who are assigned consistently in areas where we know smuggling is likely to occur. This specialized contraband and narcotics interdiction team mans all of our booking facilities. This team has been effective, and at the San Diego Downtown Jail, they have intercepted narcotics on more than 200 occasions just since January of this year. We now have better types of body scanners, which are being used to screen people coming into our custody. These scanners are more accurate in finding drugs and other contraband hidden in and on the bodies of people who come into our custody. We've centralized our jail mail delivery, and the staff at the mail processing center have inspection techniques that are finding drugs more frequently. One of our other tools is to use fentanyl and drug sniffing dogs. We use the dogs to search intake areas, parking lots, employee areas, and housing, basically every area on jail grounds. Canine handler Deputy Kirsten Racine and her partner Rex are here, and she'll be available for interviews when we conclude the presentation. Sergeant Brandon Bourgeois is next to Deputy Racine, and he will be available to talk more about contraband and narcotics interdiction if you have any questions related to that. As hard as we work to prevent drugs from getting into the jail, we also know that addiction drives and motivates a user. There's incredible ingenuity when it comes to contraband smuggling into our jails, and we recognize that we need to be prepared when drugs do get in. So in addition to interdiction and the MAT program, we also use Narcan to counter the effects of the overdoses. This tool saves lives, and we've made it available to people in custody as well as all of our staff. We do have some naloxone here on display if anyone has not seen it and would like to know more about it. Anytime we have evidence of drugs anywhere in our facilities, we conduct a thorough investigation. We find any remaining drugs and then charge and seek prosecution of offenders. We recently entered into an agreement with the District Attorney's Office to vertically prosecute these cases, so each case is treated with the seriousness that it deserves. It's important to highlight the technology and the advancements that we're also making in our jails. We have opportunities through technology to save lives, increase security, and make the jobs of our staff easier. Having said that, our jails are old, and we're never made to support the technology and infrastructure needed for modern standards of incarceration. Last year, we began a $16 million renovation of our wireless systems. One of the systems that has not worked well is our stationary cameras. It's important to all of us that we get the most accurate picture of incidents when they occur in our jails, and so that we can understand what happened. Our camera systems did not provide audio, and a lot of times were grainy or did not show certain areas of our facilities. We knew that body-worn cameras would help in this area. So last year, we began outfitting our deputies in the jails with body-worn cameras. The BWC program has been very successful, not only in documenting incidents, but also in de-escalating situations in the jail. We're one of the first county jails in California to use body-worn cameras. We've upgraded the electrical and wireless networks in our jails, which has increased our ability to expand the technology we use, not only with BWCs, but in other areas. We're developing radio frequency identification, or RFID wristbands, for deployment later this summer. The wristbands are made up of a chip and an antenna. The data stored in the device will provide our staff immediate access to medical information, such as allergies, doctor's appointments, court appearances, location, classes, medication, and other critical information. Some of the technology we're trying hasn't worked out that well. Last year, we told you about a biometric device that we were testing, and we hoped would allow us to better monitor individuals medically. We've not discontinued researching this project, but it hasn't worked out the way that we had hoped. Lieutenant David Blackwell is here today and will be available to provide more information and answer questions regarding technological advancements in our jails. So as far as staffing, we continue to work on staffing challenges in our jails. It's not unique to the Sheriff's Department here in San Diego, but it's a nationwide problem. Even with staff shortages, we've maintained services using department-wide overtime and directives and other adjustments, but it's not optimal. We continue to hire, particularly in our jail and medical services. Currently, we have 93 cadets going through the Sheriff's Detention and Court Services Academy. We have more than 200 in the background process, and we've received applications from 530 individuals awaiting a background check for various positions on our department. We began hiring certified nursing assistants last year. This is a new classification, and what it does is it helps free up our registered nurses to do other tasks. We've developed programs to hire program managers who can earn on-the-job hours toward their final accreditation as qualified mental health professional. We're actively hiring nurses, mental health clinicians, and detentions deputies. So I'd like to highlight some of the programs in our reentry services. It's one of our most promising projects. Reentry services provides opportunity, education, and job training to the people in our jail. We have a robust reentry program and a very dedicated team. When people are released from jail without the necessary support, there's an increased likelihood of reoffending or being unable to care for themselves. We have more than 36 reentry programs to prepare individuals for a return to our communities. We focus on education, career development, psychosocial, and wellness programs, as well as coordinated releases. We partner with more than 40 agencies to connect individuals with various resources for a successful transition back into society. One of our programs recently received national recognition for outstanding county initiatives, and our Veterans Moving Forward project for former military service members has been so successful it's been used as a model for implementation in other counties. Our farm stand table to your right came from our gardening, landscaping, farm to table, and construction trades program. We hope that you'll help yourselves to items from our culinary arts and baking programs. These programs offer education, job training, and essential life skills to the participants. Maribel De La Rosa is here today to share her story on how reentry programs helped her in rebuilding relationships with her family, reflecting on her choices, her role as a peer mentor, and how she is helping others navigate the challenges of the reentry process. I encourage you to speak to our reentry services manager, Patricia Ceballos, and her team to learn more about those programs. We've recently been in the news about a court case that focused on Americans with Disabilities Act, or the ADA compliance in our jails. We've taken significant steps to increase access for persons with disabilities in the jails, and we continue to move forward with our plan to be ADA compliant. Our jails, like many across the country, were constructed decades ago. Aging facilities are ill-equipped to meet the demands of modern incarceration. So at this time, I'd like to ask Assistant Sheriff Teresa Adams-Hyder to come up and address our ADA compliance unit and the work we're doing in this area.
Thank you, Sheriff Martinez. As noted, I'm Assistant Sheriff Teresa Adams-Hyder, and the Sheriff's Department has created a special unit to ensure compliance with the American with Disabilities Act, or ADA laws. This team of sworn staff, nurses, project manager, and a legal advisor will update policies and procedures, train personnel, and oversee infrastructure modifications to all of our facilities. They will work on identifying the individualized assessment process for those entering our facilities with disabilities. Some of the infrastructure changes we are making to our facilities include modifications to showers, sinks, toileting, and our beds. Grab bars, intercoms, call buttons, and mailboxes, where the incarcerated persons place their outgoing mail, have also been modified so they are more accessible to individuals with mobility issues. We are currently working on the removal of all triple bunks at all of our facilities. We will provide an in-person or remote American Sign Language interpreters for people who are deaf, hard of hearing, nonverbal, or have other communication-related disabilities. Here's a quick snapshot of our future projects behind me. An $11.9 million elevator project at San Diego Central Jail is nearing completion by the end of this year. This 25-year-old facility is going to need $35 to $40 million in future renovations. A $2.5 million intercom project is in planning for the Vista Detention Facility, as well as upgrades in our wireless, as noted by the sheriff for our body-worn cameras and other projects. Vista Detention Facility is 47 years old, and our goal is ultimately to build a new facility like our Las Colinas Women's Reentry and Detention Facility in Santee to provide detention and reentry services to our North County region. Before any construction can begin for that Vista project, a planning study must be completed regarding location, land purchase, permits, cost, design, and more. This is a challenging task that could take up to 2 years. A $1.5 million renovation of our Central Production Center at East Mesa Reentry Facility in Otay Mesa is currently in design. That's where we produce all of our food, we cook for our incarcerated population, we have our laundry services, and our commissary. This remodel includes all the preparation areas and cooking meals as noted. Next door to East Mesa, work has already started on renovating George Bailey Detention Facility. Housing units will be remodeled and could each take up to 4 months to complete. We will overhaul the key systems, door controls, lighting, flush valve systems, electrical, HVAC, plumbing, sprinklers, fire alarms, and telecommunication systems to enhance the safety of our facilities for not only staff, but our incarcerated population. During construction, incarcerated individuals at George Bailey will be transferred to the newly remodeled and renovated Rock Mountain Detention Facility. Here now to tell us more about the Rock Mountain Detention Facility is Director of Support Services, Chris Thibodeau.
Good morning. As Assistant Sheriff Adams mentioned, the Rock Mountain Detention Facility is in Otay Mesa at the same complex as our George Bailey Detention and East Mesa Reentry facilities. Here's a quick look at the timeline of renovations for Rock Mountain, which was built in 1998. Our original contractor was not able to meet the specifications of the contract award. Using a competitive public procurement process, the county accepted and reviewed proposals prior to a new award. Initial renovations began in September of 2020. Unfortunately, the global pandemic caused supply chain issues leading to additional delays in the construction timeline. Our detention facilities are subject to the California Board of State and Community Corrections, or BSCC, standards. More work had to be done to comply with the most recent BSCC standards. Rock Mountain used to be operated by a private entity for the federal government, and that was not subject to the current BSCC standards. When the facility was returned to the county, Rock Mountain had to undergo further renovation to meet requirements set forth by BSCC and ADA. We're also currently upgrading the video and telephone visit system. The cost of the Rock Mountain project was $48 million. The first housing unit is set to open this month and will serve as a transitional facility during renovations of George Bailey. Additional work on the remaining housing units is expected to be completed in 2024. The following are examples of ADA modifications made at Rock Mountain. There is increased accessibility in the common areas of the day room, including seating and lowered intercom call buttons. Here you can see a wider door clearance to navigate a wheelchair. The toilet, sink, flush controls, mirrors, grab bars, intercom, bed, and tables were all reconfigured for accessibility and proper turning radius. This shower stall meets ADA specifications for a wide opening, secured folding seat, low shower controls, and grab bars. And here's an example of the work it takes to reconfigure a shower stall for accessibility. Extensive demolition of the walls is required, modifying the plumbing, fixtures, and drain, the frame to correct dimensions, putting up new cement board and tile, as well as reinstalling such fixtures such as handrails and the bench. And here you can see we made exterior improvements to include the parking lot to meet slope requirements and provide ramp access routes to the building. The medical and administrative offices are also wheelchair accessible, including a nursing pod. And this holding cell is also ADA compliant with a wider bench and turning radius for a wheelchair. And with that, I would like to turn it back over to Sheriff Martinez.
Thanks, Chris, and Assistant Sheriff Haidar. Again, thank you all for your time and attention. We thought it was important to kind of give you some updates on what we're working on. In addition to running the facilities, we're doing some major improvements and significant advancements to technology in our facilities and trying to continue to focus on our reentry programs, which help people become better prepared to go out into society. So again, as we said, we'll provide a tour of the Rock Mountain Detention Facility that starts at noon today. The address is displayed on the screen, and part of our transition team will meet you in the lobby at the George Bailey Detention Facility. From there, a van will take you to the Rock Mountain Detention Facility. Unfortunately, due to security, no cell phones or cameras will be allowed in the facility when you're taking the tour. Information will be provided to you by our media relations team, along with a QR code to download video and photos of everything that we discussed today. And at this time, I can open it up for a few questions, and then I'd like to break out so that you can ask our subject matter experts and my team questions individually on areas of their expertise.
Sheriff, if you could address, I know that there's protesters out
Yeah.
front today who are still very angry over the death of one of the inmates. I mean, we've had 8 so far this year. Obviously, this is something that's of utmost importance, I'm sure, to the jail staff to get right, because this can't continue.
Yeah, absolutely. And I think everyone here understands that no one wants anyone to die in our custody. We do everything we can to prevent deaths, and we do a very close examination when one does occur. My sympathies really go out to the Cerna family who are outside, is my understanding today. Alyssa Cerna died in our custody 4 years ago. At that time, I didn't have any oversight or authority over our jails, but since that time, I did, however, have oversight and authority over our homicide team that did take that case to the DA's office. So if there's staff that are culpable in any of the deaths that occur in our facility, we will hold people accountable. At this time, we really are focusing on our health care in the jails. We think that's really important and key, because the people who come into our custody are not always in the best of medical and mental health conditions. So that's really our focus. But nobody wants anyone to die in custody. Any other questions? Okay, all of our staff is available if you want to ask any more questions about their areas of expertise. Thank you so much.